Good afternoon, everybody, and welcome to Riverside's Doc Talk Live series. Today we are in Williamsburg talking with Meenal Walia, a physician's assistant, about services available at Riverside Internal Medicine and Family Care Walk-in Clinic. Welcome, Meenal.
Thank you. So I want to talk about some of the services that are provided at our clinic. We are able to diagnose and treat non-life-threatening conditions for same-day appointments. Some examples of the current sort of cases that we are evaluating are with increased intensity of seasonal allergies. We see more cases of sinus and ear infections, conjunctivitis, bronchitis, and asthma exacerbations. With the warmer temperatures, urinary tract infections, acute diarrhea, abdominal problems are seen and treated in the clinic. As more people are engaging in active lifestyles, we see and treat patients for joint and muscle problems in the clinic. More people are doing home and yard, projects, and so there is an increased occurrence of cuts, wounds, rashes, and bug bites that we're able to manage in the clinic as well. Because each case is different, we try and tailor the treatment to what the individual's preferences and abilities are in order to enhance treatment compliance as well as success of the treatment. To help with making the proper diagnosis and treatment plan, we are able to perform various rapid tests in the clinic that include flu, strep testing, pregnancy testing, and mono tests. There are some labs that take longer to process, so these are sent out for further analysis. Due to our proximity to Riverside Williamsburg Diagnostic Center and the Doctors Hospital, imaging studies like CTs, X-rays, MRIs, and ultrasounds can be scheduled locally. For more complex cases, we coordinate with Riverside and local specialty offices for submission of referrals, so more thorough evaluations can be conducted. We are not able to see every acute case. Some of the situations that we're not able to see on same-day visits are refilling long-term use medications, completion of DOT physical examinations, because these require particular certifications. Due to the possibility of life-threatening acute conditions following a motor vehicle accident and the importance of timing these diagnoses, we're not able to perform these motor vehicle accident evaluations due to our limited ability to do the rapid testing needed to manage these cases. We're not an urgent care clinic. The clinic does not have the facilities like on-site imaging, stat blood tests, the ability to administer IV medications that are necessary for the evaluation and treatment of these high acuity cases. These are directed towards the emergency room as well as the various urgent care centers that are in the area. In the age of COVID, the clinic has maintained thorough infection reduction measures through the changes in the management of these appointments. All the visits are scheduled with the masks worn by the staff as well as the patients at all times. We limit patient gathering in the labs and the waiting areas by receiving these patients from their cars. We are also able to do COVID testing while patients are in the car to reduce the exposure to other staff members as well as patients. Regarding the future plans for the clinic, we are working to expand access to primary care services for completing health maintenance examinations by creating more patient panels under each of the clinical providers. One benefit of establishing care with a clinic provider is to be able to access the e-visits for completion of routine and sick visits while sitting at home. This is done through the Zoom video conferencing portal. This is our contact information that includes our address and phone numbers. Our providers are Dr. Burtons and Dr. Lorazabal, as well as nurse practitioner Robertson and Youngblood, as well as myself. So that's just a brief overview about what the clinic can provide. We can start with questions.
Okay, Thank you. And let's see, a couple of these that you've covered, but let's talk about what age patients can be seen at your practice. Patients of any age?
Basically, from birth to end of life, we're able to manage those various cases. As with health in general, there are certain chronic conditions that do develop, and so coordinating with our referrals to specialists, we can help kind of facilitate a well-rounded, well-balanced sort of patient care approach.
Okay, great, and thank you. And you mentioned safety protocols, so we won't review that again, but and you also mentioned video visits. So you do, providers of this practice do accept video visits?
Yes, you can set that in various ways. You can do online, schedule or request an e-visit, which is screened by our staff here to see, is this an appropriate case to be done through video chat, or do we need to bring you in so we can do a more thorough evaluation? Or you can call the clinic and they can schedule that time.
Fantastic. And last question, I think you may just mention this, but let's make sure for appointments, can you make any appointment online for the clinic?
You can put the request. There's a questionnaire that you fill out. So we use that to kind of screen in person or video what is the appropriate. So
fantastic.
Yes. Thank you. I want to thank the Riverside Medical Group as well as the staff here at the clinic for the respect and courtesy that they provided for me. This has definitely been a privilege and an honor to be part of the Riverside team.
Fantastic. Well, Meenal, we appreciate you joining us today, and thanks for sharing a little bit about the clinic here in Williamsburg. For folks watching this video after it will be posted on our channel. So if you have any questions, if you add them in there, we'll try to get those questions answered for you as well. We appreciate everybody's time in joining us today. We will see you next time on Doc Talk